What's up, you guys? My name is Miguel, here to give you your daily dose of radiation. In today's video, we are covering the different roles or the different positions in the emergency room or in the hospital as an X-ray tech. So to give you context, I am a night shift X-ray tech. I've been doing it for about 4 years, and I work ungodly amount of overtime, so I spend a lot of time at the hospital. So as far as the hierarchy goes, as far as tech position, you have like the top head of radiology, the one who I call it like the one who has the Thanos stones, the one who looks over MRI, CAT scan, ultrasound, interventional, the whole shebang, right? You have like the top dog. And then each branch has their own head of their department. Like ours, we have like the head of radiology, and then we have my manager, and then we have the lead tech, and then there's us, and then there's like the assistants to the X-ray tech. So like that's kind of the branch of command. And obviously somewhere over there in the top is the radiologist, who's hard to read, when we take the pictures, but that's not an X-ray tech role, but Now, as far as like what they do and how much they affect the overall flow, I mean, obviously us as X-ray techs or CT techs or any of the techs at the what we call at the battlefield, we actually deal with the patients, and we're actually performing the images or helping the patients out dealing with whatever stuff they have going on. And depending if maybe like they need so if anything happens on our shift, maybe there's like issues with the machine, or we had conflicts with certain people, we will kind of, or even scheduling stuff goes, it kind of goes to, sometimes the manager is the lead tech, but sometimes there is an actual lead tech, so we'll kind of report to the lead tech. Sometimes the lead tech is just one person who is kind of designated, maybe is like the typical Monday through Friday type of shift, and anything will kind of get sourced to them. And usually the lead tech kind of deals with all the, not drama, but just the day-to-day little things going on. And they kind of, if anything major happens or they need something higher, they kind of report to the head of like the radiology department, which is the X-ray tech manager, who's like the big guy, who typically they'll deal with like hiring people, seeing about new equipment, or just the overall workflow, how stuff can be improved or stuff like that. That's kind of their role as like the head. Typically their position is like salary and ours is hourly. And then anything major will kind of go up to like the head of radiology, which they are the ones who communicate with other branches of the hospital, other departments. So maybe if they want to change maybe some protocols, or there's like some ethical problems or anything like big, or even with the CEO of wherever you work at, and there's something major. Or at nighttime, we will typically reach out to like our manager, because the other tech is like the lead tech is like hourly, but like the head of radiology, those are salaries, so they are technically being paid regardless if they're at home or here. So typically all of them stay in the office. All the higher people kind of stay in their little cubicles in their own little place, and they'll come down to the kingdom or the X-ray department from time to time just to look at, or if they see maybe that like some of the workflow, or if they see us if we need help. If for some reason we need help in the actual X-ray tech, like the emergency room or in the main or whatever, typically they'll send the lead tech. And then occasionally, if it gets too bad and it gets slammed, the actual like head of the X-ray tech department, he can also come in and help manage or do stuff, or do. And then the last resort is like the head of radiology. They will sometimes come as a last resort if something is emergency or something, like they will come, because all of us are technically have, like, we can actually work in the field because you have licenses. Now, depending on if you want to be these roles, you may need higher level of education. Like, I know that to be like the head of radiology, like the big one, you think you need like a master's degree in like health and like some kind of health stuff. And then our actual, like, just the Xray manager, he went to school with me. He's just been very knowledgeable and he knows a lot, and he's I think he took like a little course at the hospital just as far as management goes, and like he didn't need to have a higher degree. Now obviously if you have a higher degree, it'll probably make it easier to apply and stuff like that. And then our head of radiology, I believe, holds different credentials. They hold like the Xray, I think CAT scan, and I think ours holds like three or four, which typically will always help because they can get an understanding of like the actual field because they actually been in it. But slowly over time, I've noticed like the higher ups, they get out of touch of what happens the day to day, and sometimes something major has to happen and you have to bring it to their attention, because the top people just kind of look at the overall like statistics or numbers as far as like the workflow or stuff like that, how many images and done. And then because sometimes the higher ups will see maybe that we're struggling or that maybe something's going on, and they're like, hey, if you have the same amount of text, there's a certain amount of workflow, and then it's up to us as the text to be like, hey, we need more help down here. I understand that from a statistic perspective or numbers game, like it looks like it's the same or it's less, but certain exams take longer, or maybe like we've just had terrible equipment, or there's been so many system problems. There's certain stuff that like they won't understand until they're actually seeing it in person. Like there's been many times that I think some of the higher ups had to come to our actual department and see it, and they're like, okay, yeah, we understand, and then they'll take initiative. But it shouldn't be like that, but it is what it is. And yeah, it's been your boy Miguel here to educate you on the beautiful field of radiology, and we'll see you on the next one.